everyone, welcome back to my channel. In this session, we'll be having a quick review about the two important nerves of the upper limb. They are the median nerve and the ulnar nerve. And towards the end of the session, we'll be discussing some of the important MCQs which have been asked for the NEET PG exams. So let's have a look at the median nerve first. So how is median nerve formed? Median nerve is formed by the union of two roots. One is the median root of median nerve and the other one is the lateral root of median nerve. So from where the median root of median nerve comes from? So it is coming from the C8 and T1 of the brachial plexus, that is the medial cord of brachial plexus, and the lateral root is coming from C5, 6 and 7. That is the lateral cord of brachial plexus. So ultimately the median nerve will be having C5, 6, 7, 8 and T1 root value. Now they will be joining in front of the axillary artery. So this is the axillary artery. So it will be joining in front of the axillary artery and it will be lying on the lateral aspect of the axillary artery and the proximal portion of the brachial artery, and somewhere in the middle of the arm, that is a point of insertion of the coracobrachialis muscle. So this is coracobrachialis muscle insertion point. At this point, the median nerve will cross from the lateral aspect to the medial aspect and it will be now lying at the medial aspect of the brachial artery. And when it reaches the cubital fossa, it will be leaving the cubital fossa between the two heads of pronator teres muscle. And now what happens is it will be lying in the forearm, and in the lower part of the forearm it will be lying between two important tendons. One is the flexor carpi radialis laterally and the palmaris longus tendon medially. So flexor carpi radialis and palmaris longus, in between these two tendons you will be getting the median nerve. So at this point the palmaris longus tendon is a very slender tendon, so it can be mistaken for the median nerve, but the easiest way to differentiate between the two is the palmaris longus tendon will be having a glistening appearance compared to the median nerve, where the median nerve is just a dull looking structure. Now it passes beneath the flexor retinaculum. So what is here? So flexor retinaculum is actually bridging the carpal bones. So there is a carpal tunnel beneath the flexor retinaculum. So the median nerve is actually passing through the carpal tunnel in order to enter into the hand to supply the muscles of the hand and the cutaneous innervation. So we'll be dealing with these nerves under the following headings. First, we have seen the formation of the nerve. Then we had a brief description about the course of the nerve. Then we will go and discuss the branches of the nerve. So coming to the branches, in the arm we can see that there are no structures supplied by the median nerve in the arm, but the branch to the pronator teres is actually arising from the median nerve above the elbow joint. So you can see the branch from the median nerve going to supply the pronator teres arising above the elbow joint, but no structures in the arm are supplied by the median nerve. Then what happens is, as it enters into the forearm, we can see that the main trunk is accompanied by one artery. So this artery is known as arteria nervi mediana. Arteria nervi mediana is a structure, is an artery supplying the main trunk of the median nerve in the forearm, and this is a branch of the anterior introitious artery. So in the forearm we can see that the three main muscles supplied by the trunk of the median nerve are flexor carpi radialis, palmaris longus and flexor digitorum superficialis. So these are the three main muscles supplied by the median nerve, the trunk of the median nerve in the forearm. And you can see one important nerve arising from the median nerve. This is the anterior interosseous nerve, and this is accompanied by the anterior introitious artery. It is actually lying over the interosseous membrane. And the three muscles supplied by the anterior introitious nerve are flexor pollicis longus, flexor digitorum profundus and pronator quadratus. When we discuss these three muscles, flexor digitorum profundus is having a dual supply. That means only the lateral half of flexor digitorum profundus is supplied by the median nerve, whereas the medial half is supplied by the ulnar nerve. You have to keep this point in mind because this is a favorite question for most of the examiners, be it theory or MCQs. Now what happens is, before passing through the beneath the flexor retinaculum, we can see a cutaneous branch emerging. So where is it supplying? So the palmar cutaneous branch is supplying the region over the center of the palm as well as the thenar eminence. So this region of the palm is supplied by the palmar cutaneous branch. After that, after passing through the carpal tunnel, it divides into a medial branch and a lateral branch. First we will see the lateral branch. So the lateral branch is having a recurrent branch and it is supplying the three major muscles of the thenar eminence. They are abductor pollicis brevis, flexor pollicis brevis and opponens pollicis. And further what happens to the lateral branch? We can see that it is dividing into three proper branches. So at this venture, I would like to add one more important point. When you hear proper digital branch and common digital branch, proper digital branch means it is just supplying one side of the digit. Whereas when you hear the common digital branch, it has to divide into two proper digital branches in order to supply the sides of the digit. So that's the difference between the common and proper digital branch. So here we can see that there are three proper digital branches arising from the lateral division. And where are they supplying? They are supplying the lateral aspect of thumb, medial aspect of the thumb and the lateral aspect of the index finger. So that is the supply of the three proper digital branches arising from the lateral division, and it is also supplying the first lumbrical muscle. So first lumbrical is getting its supply from the lateral division. So we just mentioned about the palmar supply, but apart from the palmar supply, the three proper digital branches are also supplying the distal phalanx of on the dorsum of the thumb and the middle and distal phalanges of the index finger, the middle finger and also the lateral aspect of the ring finger. So the dorsal surface is also getting supply from the median nerve. Now what about the medial branch? Medial branch is actually giving a branch to the second lumbrical and it is further dividing into two common branches which are further dividing into two proper branches. So two common branches, 1 and 2. So these are the two common branches. So two common branches should divide into proper branches in order to supply the digits. So where are they supplying? So these two common branches are supplying the medial aspect of the index finger, the lateral aspect of the middle finger, and the next common is supplying the medial aspect of the middle finger and lateral aspect of the ring finger. So all together up to the ring finger you have 1, 2 and 3 and plus half of the ring finger. So 3.5 digits supplied by the median nerve, and it is also giving a communicating branch which will be communicating with the superficial branch of ulnar nerve. So this is about the muscular and cutaneous branches. And what about the articular branches? It supplies the elbow joint, it supplies the superior and inferior radioulnar joints, and it also supplies the wrist joint. And about the vascular branches, it is giving vascular twigs to the major branches like the axillary artery and the brachial artery. Now coming to the ulnar nerve. So how is ulnar nerve formed? Ulnar nerve is mainly formed by C8 and T1, that is from the medial cord of brachial plexus. It also receives a branch or a contribution from the C7, and that is actually supplying the flexor carpi ulnaris. So altogether you have the C7, C8 and T1 giving rise to the ulnar nerve. Now we will discuss about the course of the ulnar nerve, then we will come to the branches. So the course of the ulnar nerve, it lies medial to the axillary artery and brachial artery, and somewhere in the middle of the arm you have the medial intermuscular septum which separates it into anterior and posterior compartment of the arm. So at the medial intermuscular septum, somewhere in the middle, it pierces the medial intermuscular septum and goes to the posterior compartment, and now it will lie behind the medial epicondyle. So we can see, we can feel for the ulnar nerve just behind the medial epicondyle, hence it's known as the funny bone. Now we can see that it is going between the two heads of the flexor carpi ulnaris. Here it was the pronator teres, but here you have the flexor carpi ulnaris muscle. So between the two heads of flexor carpi ulnaris, it will enter into the anterior aspect of the forearm. And towards the lower aspect of the forearm, we can see that it is lying between two important structures, the ulnar artery laterally and the flexor carpi ulnaris medially. And at the flexor retinaculum, Here we have seen the median nerve going through the carpal tunnel, but here it is going over the flexor retinaculum and it is entering into the hand. Now let's see the branches coming from the ulnar nerve. As we have seen in the case of median nerve, no structure in the arm is supplied by the ulnar nerve. In the forearm, the main branches supplied by the ulnar nerve are flexor carpi ulnaris and flexor digitorum profundus. So when we discuss about flexor digitorum profundus, it is a muscle with dual nerve supply. So lateral half is supplied by the median nerve and the medial half is supplied by the ulnar nerve. Now what happens is, just before crossing over the flexor retinaculum, it is giving a branch to the dorsum of the hand. So it will give the dorsal cutaneous branch which will be supplying the medial aspect of the dorsum of hand. And after that, over the flexor retinaculum, it will be giving a palmar cutaneous branch which will be supplying the remaining aspect of the palm, that is the skin over the hypothenar eminence. Then it will go beneath the palmaris brevis and will divide into two important branches. This is the superficial branch of the ulnar nerve and this is the deep branch of the ulnar nerve. So what happens to the superficial branch? It will give a recurrent branch to the palmaris brevis, the muscular branch, and then it divides into one proper and one common branch. So medial most is one proper branch and the lateral one is the common branch. So proper means one branch. So it will be supplying the medial aspect of the little finger and the common branch will divide into two proper branches and it will supply the lateral aspect of little finger and medial aspect of ring finger. It also gives a communicating branch to the median nerve we have already discussed here. Now what about the deep branch? Deep branch actually occupies the concavity of the deep palmar arterial arch. So this is the concavity of the deep palmar arterial arch. Here you have the deep branch of ulnar nerve which supplies almost all the intrinsic muscles of the hand, like the three hypothenar muscles. Then you have the third and fourth lumbricals, all the interossei, the palmar interossei as well as dorsal interossei, and also adductor pollicis. So we can say in a nutshell that all the intrinsic muscles of the hand are supplied by the ulnar nerve except the 5 which are supplied by the median nerve. So the 5 supplied by the median nerve are the thenar muscles, abductor pollicis brevis, flexor pollicis brevis and opponens pollicis, and the first and second lumbricals. So remaining all intrinsic muscles of the hand are supplied by the ulnar nerve. Now about the interossei, something about the interossei. There is a code for interossei. It is pad and dab. This will be needed for you in order to solve some of the MCQs. So pad means palmar interossei and AD means adduction. So adduction of digits by palmar interossei, and dab means dorsal interossei abduction. So abduction of the digits by the dorsal interossei. I will be doing a session of the muscles later. For the time being, you just have an idea about the important functions. Now, the lumbrical muscles, we know that they are known as bi-bi muscles, western bi-bi, okay. So, it is flexion at the metacarpophalangeal joint and extension of the interphalangeal joints. So, that is the main action of lumbricals. Now, something about the flexor digitorum superficialis and flexor digitorum profundus. Flexor digitorum superficialis is getting inserted to the middle phalanx, so that means it can flex the proximal interphalangeal joint, whereas flexor digitorum profundus is getting inserted to the distal phalanges, so it will help to flex the distal interphalangeal joint. You have to keep that point also in mind. And let me discuss some of the important nerve lesions, like for the median nerve, the important one is carpal tunnel syndrome. So carpal tunnel syndrome, when the nerve is compressed in the carpal tunnel, it will result in weakness of all these muscles and there will be altered cutaneous sensations according to the nerve supply, that is the 3.5 regions. And if it is getting a lesion at the cubital fossa or above, all these muscles, all these flexors will be affected and the patient won't be able to flex the digits. Coming to the lesions of the ulnar nerve, if we have a compression of the ulnar nerve behind the medial epicondyle, you call it as cubital tunnel syndrome, and all the remaining branches of the ulnar nerve will be affected. At this venture, I would like to discuss an important terminology, that is ulnar paradox. So what do you mean by ulnar paradox? Suppose this is a nerve and it is giving off many branches. So if there is a lesion for the nerve at the upper part, what happens? All the branches will be lost, and we say that the lesion is severe and the signs will be severe. But if you consider a lesion somewhere at the lower aspect, all these branches will be saved and we expect a minor sign or a minor lesion for the nerve. But in case of ulnar paradox, what happens is, suppose if you get a lesion high up somewhere here, what happens is all the branches of the nerve will be affected and there will be poor flexion of the medial 2 digits. So what will happen? The lumbricals also will be lost. So the normal action of the lumbrical is flexion at the metacarpophalangeal joint and extension of the interphalangeal joint. So if this is weak, the hand will be like this. Okay, the medial 2 digits. That is the supply of the ulnar nerve. And all the flexors also will be weak. So the flexion also will be weak. So this is what happens if you get a higher lesion of the ulnar nerve. So, but when you get a lesion at the lower aspect of the ulnar nerve, what happens is the flexor digitorum profundus to these 2 digits will be saved. So, what happens? The lumbricals will still be affected. So, it will be extended at the metacarpophalangeal joint. And there will be slight flexion of the interphalangeal joint, but if the flexor digitorum profundus is saved, if you have a lesion at the lower part of the ulnar nerve, the flexor digitorum profundus will make the digits more flexed. So when you have a look at this, you will see that there is more clawing. So more clawing is not because the nerve is injured more, you are saving the flexor digitorum profundus and that is actually flexing the digits. But when you see the lesion, you see that, oh, that poor person is having more clawing of hand. So it is not more clawing of hand if you get a lesion at the lower aspect. It is the normal flexor digitorum profundus which is acting. So it is known as ulnar paradox. The lesion is severe in the upper part, but when you see the person, the clawing will be more prominent if you get a lesion in the lower part. And about clawing of hand, this is actually partial clawing if you get only the ulnar nerve affected, and if your hands are like this, all the fingers affected, then only you can call it as complete clawing, or this lesion you have to get it at the brachial plexus level, and that is known as Klumpke's paralysis, where both the median nerve and ulnar nerve are affected. So if only ulnar nerve is affected, you will get only a partial claw hand. That point also you have to keep in mind. Now let's move on to the questions which are routinely asked for the NEET PG exams. The first question, actually I would like to thank Jaydeep Chauhan who has contributed this question. So let's see the first question. A patient presents with hypothenar muscle wasting and loss of sensation over medial 1.5 digits. Which nerve is involved? The options are ulnar nerve, median nerve, radial nerve and musculocutaneous nerve. This is quite a straight answer. The ulnar nerve is affected. We have seen the ulnar nerve, its supply. So it is over the hypothenar eminence. So we can see, we have already seen that it is the ulnar nerve which is affected. Now going to the second question. The second question is, median nerve lesion cause paralysis of all of the following except. So the options are thenar muscles, adductor pollicis, lumbrical of the index finger, lumbrical of the middle finger. So we might think that since the two options are lumbricals, it could be one. No, we know that the median nerve is supplying the first and second lumbrical, so they are not the answer. It is the adductor pollicis, because adductor pollicis is supplied by the ulnar nerve. It is the abductor pollicis which is supplied by the median nerve. Now we will move on to the next question. A patient is trying to make a fist but can only partially flex index and middle finger. Which nerve is damaged most probably? The options are median nerve, ulnar nerve, radial nerve and anterior introitious nerve. So if you try to make a fist here, so making a fist is like this. So the patient is able to flex the ring and little finger, but he is not able to flex the index and middle finger properly. He is not able to flex the index and middle finger properly. So his hand will be like this. So index and middle finger he is not able to flex means the flexor digitorum profundus, flexor digitorum superficialis to these digits, especially the flexor digitorum profundus is affected. That means which nerve is affected? The median nerve. The lateral half of flexor digitorum profundus is supplied by the median nerve. So this deformity is known as Benediction's deformity. Benediction's deformity means the median nerve is affected and the hand will be like this. So here the answer will be median nerve. We will move on to the next question. In arm, ulnar nerve gives muscular branches to which muscle? In the arm, ulnar nerve gives muscular branches to which all muscles? First option, flexor carpi ulnaris. Second option, flexor digitorum profundus. Third option, both. And fourth option, none. So if we see both the muscles, sometimes we might have a thought like it could be one, it could be both, but here we have to think again. They are asking muscular branches in the arm. Ulnar nerve is not giving any branches in the arm. So the answer is none. The next question is, what do you mean by ulnar paradox? We have discussed in detail about ulnar paradox. Among the options, we can see the first option itself. It is a high level injury with less severe clawing. So that is what is meant by ulnar paradox. High level injury, you expect a higher clawing, but here we are seeing the maximum clawing when it is at the lower aspect because the flexor digitorum profundus is escaping from the injury. So here it is high level injury, but usually we expect a severe clawing, but here we are getting a less severe claw hand. So that is what is meant by ulnar paradox. Coming to the next question, superficial branch of ulnar nerve supplies. The options are palmaris brevis, the abductor pollicis, abductor digiti minimi, opponens pollicis. So the superficial branch is actually giving a branch only to one muscle, that is the palmaris brevis. All the rest are supplied by the deep branch of ulnar nerve. Next is Froment's sign or Froment's test is to check which muscle. The options are opponens pollicis, flexor pollicis brevis, flexor pollicis longus, adductor pollicis. So this is actually a test to detect the action of adductor pollicis muscle. So if you ask the patient to keep the paper between the index and thumb finger, and if you try to pull this, what happens is if the adductors are strong, he will try to resist your pull by holding the thumb straight, and the paper will be held between the index and the thumb will be straight. But if the adductors are weak, what happens is he will still try to hold the paper by flexing the thumb with the help of the flexors. So in that case, the adductors are paralyzed. So that is actually a test to detect whether the adductor muscles, adductor pollicis longus, adductor pollicis brevis is working or not. So Froment's test is to test which muscle? It is the adductor pollicis. Now the next question is, nerve supply to dorsal interossei are by radial nerve, ulnar nerve, median nerve and the ulnar and median nerve combination. So it is again a straight question. We have seen that all the interossei, whether it be dorsal or whether it be palmar interossei, all are supplied by the ulnar nerve. Now the next question, following a deep cut overlying the hypothenar eminence, the patient cannot hold a sheet of paper between the second and third digits. Which of the following nerves are most likely to be damaged? Second and third digits. So deep branch of ulnar nerve, deep branch of radial nerve, superficial branch of ulnar nerve, median nerve. So what is the action mainly? You are not able to hold this like this. So that means the adduction is not possible. Adduction of the digits are not possible. So adductors are, we have already seen dab. Dorsal are pad and dab. Palmar interossei are PAD means palmar interossei are adductors and DAB means dorsal interossei are abductors. So here it should be adduction. That means palmar interossei should act. And we have already seen that ulnar nerve is the nerve which supplies all the interossei. So which branch of ulnar nerve? We have two options, superficial branch and deep branch, but superficial branch of ulnar nerve is supplying only one muscle, that is palmaris brevis. So it is the deep branch of ulnar nerve which is supplying the interossei. Now coming to the last question, a patient with leprosy presents with ulnar nerve involvement and clumsiness of hand due to palsy of which muscle? That is a question. So clumsiness of hand means the hand will be too weak and it's not able to adduct or abduct the digits. So that is what is meant by clumsiness. So we can see many muscles as options: extensor carpi ulnaris, abductor pollicis brevis, opponens pollicis, interossei muscles. So among these muscles, the main contribution is by the interossei muscle. So they are actually responsible for the entire clumsiness of the hand. So we can opt for the interosseous muscles. So this is about median nerve and ulnar nerve in a nutshell, and with some of the questions. And the next week I would like to discuss something from the lower limb. I would like to get your suggestions in the comment box. And if you have some questions to be discussed, please share the questions with the options as well. I would be so grateful to you if you could do that. Thanks for watching. Leave your comments so that I can improve the session in the coming videos. Thank you so much.